Last week, Lekan Sote, a journalist, broadcaster, and columnist with the Punch newspaper, shared his COVID-19 experience with us on the show. This week, we bring you the concluding part. Please stay with us. I'm Olasumbo Modupe.
The Nigeria Center for Disease Control says there's no scientific evidence that body-worn labels of tags marketed as Air Doctor by members of the public can protect individuals from getting infected with COVID-19. According to the agency, these body tags are touted as air disinfectants with the ability to inactivate any germ within the surrounding of the wearer over a long period of time. There are no evidences to support the claim that Air Doctor offers the benefit to the wearer, as the active ingredients, which are often advertised as chlorine dioxide with sodium chloride, do not exist in the environment for a long time and can lead to serious health effects, especially in children. The NCDC says anyone who chooses to wear these tags should continue to adhere to the other non-pharmaceutical interventions which reduce the risk of transmission of the virus. As schools begin to reopen in some areas, the public are cautioned to adhere to protocols and advisories for reopening. The Health Minister, Osagie Enakere, said records show that 10% of all positive cases have been treated are below the age of 19 years. In Lagos, Governor Babajide Sanwo-Olu has ordered the resumption of all public and private schools from September 21, 2020. Only pupils in Junior Secondary School 3 and Senior Secondary School 2 are allowed to resume for physical classes in public schools. Governor Sanwo-Olu said public schools resumption would allow the GS3 students to revise and prepare for Basic Education Certificate Examination (BECE) slated for October 12, 2020, while students in SS2 will use the period to prepare for their transitional exams to SS3. Unlike the resumption schedule for the public schools, the governor permitted all levels of classes in private schools to resume, but with strong advice to school owners to consider implementing a staggered daily resumption schedule and classes on alternate days during the week. However, all pre-primary school classes, including nursery, daycare centers, and kindergarten in both public and private schools, are not permitted to open. Governor Sanwo-Olu also granted permission for immediate reopening of cinemas and gyms, with a maximum of 33% occupancy, stressing that there must be a minimum of 2 empty seats between occupied seats in the cinemas. In the case of gyms, the governor said there must be constant disinfection of machines and equipment throughout the day. He said the state governments will be taking definite decisions on the reopening of nightclubs, bars, event centers, spas, public parks next month, warning that the dire consequences awaited those in this category that may want to flout the restrictive order. Sanwo-Olu also further eased the restrictions of houses of worship, permitting observation of daily prayers in mosques and granting midweek services in churches. Over 57,000 confirmed cases and more than 1,000 deaths have been reported in Nigeria, while globally there are over 31.5 million confirmed cases, over 969,000 deaths, and 23.1 million recovered.
How has life been since that phase? How have you been able to relate well with family, friends, and colleagues?
Well, when you are discharged, they give you some drugs to use when you are discharged. And those drugs will last about, about 10 days or so. And then as you are leaving the isolation center, they contaminate you with some chemicals. They spray you all over, spray your shoes, your dress. Even if you brought a box or a bag, they open it and spray it. Even the people that came to take you home, those who came to take me home, they sprayed them with the chemical. And I nobody asked me not to go out or anything, but I was taking those drugs, and I just told myself that I would give myself another 14 days on my own. Just stay at home for another 14 days. Don't necessarily go out and visit anybody, and don't encourage anybody to visit me either. So after the 14 days, I then went for the test. I want to be certain that though I was feeling well, I was feeling better. The drugs finished, and I was feeling well, but I'm not a doctor. I needed to be certain. So I went back again for another test. And after about a week or so, I got an email confirming that I was now negative. So I started going out. And the funny thing is that my sons who live with me, they went for the test, they were negative. Nothing happened to them.
Wow. Which
surprised me, though I'm happy that nothing happened to them. But so you can see that you have no idea. Though I was ill, we were in the same house together. Somehow they didn't catch the thing. And though when I went to the isolation center, I did not encourage them to come visit me. But the day I was going out, I asked them when they were coming to pick me up, I asked them to go for the test, which they did. And after about 4 or 5 days, the information came. The report came from the place that they were negative. So I, don't have problems. Well, maybe I have not noticed anybody trying to avoid seeing me. Because I have also personally tried to just stay on my own.
Okay.
But now that I know that I'm okay, even then I'm also careful, because now that I'm okay, I don't want to go out again and go and run into another trouble again. So I pick my outing. I'm careful about where I go. I don't want to have this a second time.
Okay. So that brings me to my next question. Have you been stigmatized? Since you said you've not been going out, I would have said, have you been stigmatized by colleagues, friends, and families?
No, I have not. But I told you, I deliberately did not go out to see people. And I also did not encourage people to come visit me. It's just a deliberate personal decision, And I wanted to be sure that I was okay. So when I went for the second test, I waited for the result again, and then they said I was okay, And so after I got the result, I've been going for meetings and all that. And one of the reasons, I don't know if you read, I wrote in my column, because I thought people should be aware that this thing is real, because a lot of people keep saying it's not real. So I thought to myself that if I had such an experience, maybe this is God probably just wanted to get me to be able to talk to Nigerians that this thing is real. And if you observe, after I wrote my column sometime last month, after I was discharged, a lot of top Nigerians have started coming out openly that they fell ill and they were in isolation. A lot of them kept quiet initially, maybe for fear of being stigmatized. But after I spoke, I wrote in my column, I saw that a lot of them have come out. I don't want to mention names, but I'm sure you are aware of some prominent government functionaries who have started to come out in the open that, oh yes, they had an experience with this virus, It was deliberate for me to do that. And I really, really didn't care if anybody spoke to me. And in any case, I normally keep to myself much, I only go out, do my business, and go back to my house, even before the thing. So I didn't miss anybody not talking to me or not visiting me, because I normally don't really encourage people visiting me from time. I don't visit people that much, and I don't discourage people from visiting me, but I'm not that. I have a lot of things to do. I'm writing a lot of things. I'm writing, I'm reading. I do quite a lot of writing and reading. So I feel if you come and disturb me, I won't even be, from time, I always kept to myself. So I didn't notice if anybody was trying not to see me. I have not noticed. But people, if I've had meetings, reasons to have meetings with people, after I got the result, I went out, I saw them, met them. And I know that they are aware. And nobody has tried not to talk to me or not. I have not noticed, at least.
As a key player, what is your assessment of efforts in flattening the curve in Nigeria?
Well, since I'm not in government, what the information we have is out there in the public domain, is in the media. And then I can always talk also from my own personal experience. I can tell you for free that throughout my stay in the isolation center, I was never asked to come and pay anything. My treatment, my feeding, everything was free. I was told, because being a journalist, you'll be nosy, you want to ask questions. So I was asking, because after the first day, I said, how do I pay? They said, no, you don't have to pay. I said, what do you mean? They said, some people, corporate organizations, some individuals, have donated money to take care of patients, of this COVID-19. So I can see that, and that Lagos State, we all read that the federal government, in the case of Lagos State, gave, I think, 10 billion naira, to Lagos State to combat this. And Lagos State itself has made money available. You can see the isolation centers they have created all over the place. Now the tests that are, I was tested. That means government has set up. Now, but I do not know if that is enough. As at that time, I was told that there are 4. I don't know if there are others now. That there are 4 centers in Lagos, and my information is that all the 4 centers are probably within the Yaba local government. So therefore, somebody who is in Ekpe, who is in Badagry, where does he go for his test? Now they may have had other test areas, centers now, or analysis centers now. I do not know, but at that time I was told there were just 4 in the isolation center at Yaba, at I think a research center at Youth, those 3, and I think a 4th place, I can't remember, which are all within 1 or 2 local governments. So which worries me that people in Badagry, people in Ekpe, how do you look after them? People in Paja, does it mean they have to come out of that place before they can be properly tested, or before their sample can be properly analyzed?
There are now test centers in each local government.
Good. If you can test in each local government, but the analysis of the sample, that's what I'm talking about. I understand there are just about 4 places, and that is not adequate. That's not good enough. Okay. I think each local government at least, should. And when I say local government and LCDAs, which I think there are about 50 something of them now, I think you'll have at least 1 place for analysis, so that where people can take the sample, where they can take the samples, so that the result. Think about it. My result came. Formal result came. On the day I was discharged. Do you understand that?
Yes, I understand.
Sample was taken on Monday. Result came on Sunday. Wow. Just 1 or 2 hours before I was discharged. Somebody called me and told me, and I was like, he says, where are you now? I said, where am I? The guy was laughing. He was saying, he thought I was not serious. I said, where you want to know where I am? He said, yes. I said, well, I am at the isolation center. He said, after he had told me the information, I guess he was trying to let me know so that they can come and pick me up or something. I said, I'm here and I'm just going to be discharged in the next 1 or 2 hours. Wow. So I think the rate at which the report comes is a bit too late. Okay. 1 week, if I had waited at home for 1 week, only God knows what would have happened.
Okay, so what message? Yes, I do. What message do you have for people who still doubt COVID-19 is real?
Well, we can only talk to them, and I just hope that they will not have to find themselves at the isolation center or even at ICU, because what I'm told is that what helped me was that I was quite vigilant. I hadn't had it from what they are telling me, for more than a week before I got into isolation, to the isolation center. So quickly, actions were taken to revive. Okay, if you wait and it becomes too much in you, if you end up at the intensive care unit from day one, that is very dangerous. So everybody should go check up himself. And the government should ensure that there are more analysis centers so that results can come out within a day or 2 days, not for a week. Or somebody told me that his own result came in 19 days.
Wow.
But he had started self-medication. Luckily, the person is alive, but anything could have happened if he or she had gotten it wrong. So, people should go test themselves. That's my counsel to everybody. Go and look for a test center, test yourself, arm yourself with information. The knowledge that you are okay, know it, be certain that, like I told you, after I came back, they gave me some drugs when I left the place. The drugs lasted 10 days. I advised myself to stay at home for 14 days. After that, I went for another test. Nobody asked me. I went for another
Just
test.
to be sure.
And then I got a mail saying that you are negative. Do you understand? So that I'm not living in a fool's paradise. So we are at the level of community transmission, which means it's out there. So everybody must, in their own interest, go test themselves. Whether or not you believe, let the doctors tell you that you are negative or positive. Don't just be talking to yourself. This is not a motivational thing now. You need science to back up your decision. You need science to tell you how to live your life so that you know that you are safe. It's very important, And so we have to be vigilant, very, very well. We have to be vigilant. We have to pay attention to our health so that it doesn't get to a level where you end up at the ICU on the first day. If you're at ICU, that is more dangerous. I was told that my own is mild because we spotted it within a few days and we took action. But if you feel that you can wish it away, and I'm not saying people should not pray. You should pray, but back your prayer with science, with information, knowing that you are okay. And then you say, well, God protected me, fine. But based on science, not your assumption. So it's better for us to go look after ourselves, go for the test, just to be on the safe side.
All right, sir.
I can't overemphasize the fact that I was lucky to take action very quickly.
All right, sir.
And that really helped me.
All right, sir. Thank you so much, Mr. Lekan Sote, for your time. We really value your experience. This was really an eye-opener.
Thank you very much.
Well, I have been talking to Lekan Sote, a journalist, broadcaster, columnist with the Punch newspaper who conquered COVID-19. I am sure his experience has dispelled some myths and misconceptions about the virus. Soundhealth continues with trending health news. Please stay tuned. It's still Soundhealth on Lagos television. Stigmatization of persons who have been diagnosed with COVID-19 can discourage those who have been exposed from getting tested. Let's stop stigmatization associated with COVID-19. Stay safe and observe all precautionary measures against COVID-19. That is it on Soundhealth this week. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #Soundhealth. A sound health is a sound mind. Make healthy living your choice.